Good day, Peter, and thank you very much for giving some time to talk to the Mint.
Delighted to be here.
Well, I wanted to start talking about what the world looks like from where you're sitting in India. And of course, the issue that's affecting all of us around the world is the pandemic. So maybe you could give us a bit of a feel for how you think things are going in India.
So, as most of you have been listening, the numbers have been going up and up. We expect that to be the case. People are talking about the peak coming in anywhere between the end of June and middle July. I think some of the most interesting features is the huge unevenness in how COVID has affected India. And one of the things that would be very nice to discuss is actually some of the lessons, perhaps, to be learned from some of the states in India for other parts of the world.
So, okay, the fact that the peak is still reaching, is that because India was later in its starting, or would you say globally it's been worse in India than a lot of other places?
It's a little difficult to say. I would say that one of the things that is clearly happening is you will see a slightly uneven progression across Indian states. However, most Indian states actually began the process relatively early. We had quite a lot of warnings, and I'll put this in UK context as well, because I was traveling to the UK around March the 10th, and I came back to India March the 14th, having experienced what I thought was quite an alarming situation underway in the UK. So by the time I had traveled, to just put this in context, we had already, at least in the state of Karnataka, been hearing about a month's worth of messaging. Every time we picked up a phone, we listened to a message telling us that we needed to cover up, wash hands, watch for these symptoms, and be very careful.
Suggesting, therefore, that you think you were, at least your state, was ahead of the game in terms of taking action compared to the UK.
I think that's right. You know, it's only in retrospect that one understands what the bureaucrats are up to. So on the one hand, clearly, there had been, both from certain politicians as well as bureaucrats, quite a lot of attention with health policy on the ground to understanding what they would need to do, the anticipation of maybe COVID hospitals, patient tracing, anticipating possible lockdown, what to do with international flights. I think everybody was looking both to China as well as to Western Europe and trying to understand what to prevent and what to learn from. So it was messy, as you know, all across the world.
And of course, in India, there are quite a number of states. And presumably the performance and approach was different in different states. Is it a state power? Is it the states who are the main actors, or is it the federal level?
So India is a quasi-federal system, and what that really means is some of these subjects, especially things like health, are really handled at the level of the states. Obviously, there are systems of fiscal transfers, grant sharing, the public finance architecture of the Indian type of federalism is relatively well established. So some of the arguments politically are whether the center and Indian states have been doing what they need to do, maybe as efficiently as they need to do it. But what has really got hidden in the debate is how differently Indian states have actually responded. Why that's important is that most Indian states are the size of Western European countries. So it does become quite interesting to understand what is going on, why is it so uneven, what lessons might we take away? And because it all gets bundled under the word India, unfortunately, a lot of the really interesting stuff isn't discussed.
So what would you say, what are the things that have really struck you about the different approach by different states and the success or lack of success that they've had?
I think, as you probably know, a lot of this gets discussed almost exclusively in terms of party politics. One of the things that's exciting about economics in terms of a pluralistic agenda is we can source from other perspectives and other disciplines. And I think the psephologists and those who are really focused on electoral politics have also missed some of the interesting stuff. And that's because they're focused very much on party politics. Actually, the Indian scenario is quite intriguing because it cuts across which states are ruled by which party. It cuts across a little bit about the economic constitution of states, which ones have been able to deal with everything from migrants to food logistics. In my own state, Karnataka, which is, I would say, roughly between Italy and the UK in terms of size, one of the things that's really fascinating is it is, of course, India's big economic engine. It's the place with the highest concentration of tech, lots and lots of science and engineering institutes, very, very large, high-skilled migrant population. It's a sort of a different story. And maybe because of that, one of the things that's quite interesting is how they've dealt with it. Some of the features are quite clear. The state of Karnataka, where Bangalore, as you know it, or Bengaluru as we call it, Bengaluru is about the size of London, and it has a very small number of cases. The state has relatively decent, by Indian standards, testing, although still very low by global standards. Probably about between 85 to 90% are asymptomatic from the minimal testing coming in. And yet the state count and the overall way in which they've dealt with it has been very surprisingly well done. Patient tracing has been exceptional, the contact tracing. Massive, huge efforts by the police and the health authorities to trace international travelers. I experienced it firsthand myself as I was coming back in from the UK, and it got stricter and stricter ever since. So we'll see how it goes opening up now.
And that seems to follow a pattern that the most successful areas have been the ones who keep the cat in the bag, if you like, or act quickly, trace, and keep the numbers very low. But it seems once the numbers get really high and get away from you, then it becomes very difficult to keep a handle, to track, to trace, and so forth. So it must have moved fast. Was it also lucky that it didn't, do you think, have a lot of cases to start with?
I think from an economic standpoint, these are obviously all difficult decisions, even if you listen to the health experts, even if you listen to the folks dealing with logistics. Obviously, there's some hard choices here. In a 2-week period, just about the time I returned from the UK, the police and the health authorities in the state of Karnataka, in Bangalore in particular, in Bengaluru city, which is roughly about the size of London, contact traced 44,000, approximately 44,000 international travelers. Remember, Bengaluru is a big tech hub, so everyone's traveling. And they traced them, person to person, followed up with them twice a day, checking in by phone survey, and a phone call. And it got more stringent from what I understand after, because of course then I went into self-isolation for 2 weeks. And I had a stamp put on my hand that said, proud to protect Bengaluru. But one of the things that is interesting about it is clearly the economic decisions are complex. You have to shut down your airports. You have to deal with all kinds of job losses.
What about, there's one of the decisions, and then there's the implementation. And you said yourself that it was surprisingly well done. And I suppose there's an impression that bureaucracy in India is not always efficient and effective. Is it? And I don't know the detail, but that's just it. Why do you think they've been surprisingly effective in this case?
I think that's a good question. It was surprisingly effective because so many things had to be done. And we're looking across the globe and we're seeing that governments, both national and subnational, if they're large enough, have so many decisions on their table to address.
Yeah.
I think from the bureaucracy standpoint in India, of course, the bureaucracy is quite well established. We have both an administrative service at the national level, you have state level groups, you have the police, which are handled at the level of the state, then you have health workers. What was surprising was not so much that this was the situation in some of the big cities. What is surprising is that at the level of districts and villages, there has been quite a lot of positive information coming in about how groups have handled it. So I do think that one of the things that's quite compelling is to try and understand how big a deal COVID actually is. Because, of course, one problem that India has, which a lot of Western Europe doesn't have, is all the co-circulating diseases that need attention.
Right.
Dengue, H1N1, all the rest.
Yeah. Just before we get on to that, just a practical matter, obviously, is social distancing. And one of the things one might think is that India, with a very high, dense population, would find social distancing more challenging. And obviously, in the UK, people with larger houses, nice gardens, it's all much easier. If you're very much squashed into small accommodation and so on, then it's much more difficult. How has that sort of played out?
I think an urbanist would probably say that it depends on the city. I think one of the reasons Mumbai has had so much difficulty is obviously the level of density in both rich as well as poorer areas. Presumably the same is true of parts of New York City. Density isn't your friend when you're dealing with this kind of situation.
So the areas in India the states with more dense populations are generally doing worse, are they? Is that a pattern, or probably is it more complicated than that?
I think the situation is more complicated. So Bengaluru, by and large, is less dense, depending on how you think of it relative to Mumbai. There's no question. But you could argue that in Maharashtra itself, which is the worst hit Indian state, the city of Mumbai and the city of Pune, which are dramatically different in terms of density overall, have both been affected. And some of that has been how transport and so on has been dealt with between the cities of the same state. So I think your point about how one deals with things early and how much perhaps politicians hand over charge or listen to experts or consider their administrative apparatus and hand over a certain level of control. These do matter.
And so how did that play out in Mumbai? Were they late, would you say, in making decisions, and so it got out of control? And what were the factors that led to that?
I think this is all relative. This is the challenge. Remember that as of, I think, today, India has still just about under the total number of cases that Italy has had. So in terms of the overall roster, that's still quite low globally. In terms of mortality rates and in terms of number of deaths, India is incredibly low. So we have to maybe ask a different set of questions. Should we be even comparing these cities across countries or these states across countries? And I think for economists, this is both the question no one wants to ask, but also the question that's quite hard to answer, which is if you don't contrast, you lose a tremendous opportunity to learn from each other. On the other hand, it's not clear with over 80 or 90% asymptomatic in some of the cities in India, even with low testing. What does that really tell us? It either tells us, amongst other things, that perhaps Indians aren't going to respond in quite the same way to COVID as in the UK or in Spain. And why is that? I don't think biologists know the answer.
I mean, that's sort of interesting because here in the UK, the BAME population has been much harder hit. Now, I don't know, obviously that's lumping together people with very different genetic heritages, but so I'm not quite sure if the case of a sort of Indian heritage is very different from Afro, for instance, or whatever, but that is interesting. What about, just moving on, one of the things, if you have this patchwork of results in different states, do you think it's likely that, and this is happening at the moment, that states will control the movement of people within India between states to avoid the states where there's large prevalence from bringing infection, increasing infection into the states that have low prevalence? And how could that affect things?
So just to return to the previous point, however, because I think it is actually something that affects this question as well. I don't think this is about genetics. This is also about how many co-circulating diseases we see every year about this time. And people have commented about relatively low rates in terms of morbidity or mortality or recovery, even in previous SARS-type infections. So this may be something that really is a combination of geography as well as kind of economic response.
Just following up on that then, so do you think that because Indians are more affected by a much greater set of disease, they may have a tougher immune systems effectively? Is that a possibility?
That's a question for a biologist. This is certainly the season for a huge number of theories as well as diseases.
Okay.
No one knows. Yeah.
No. So, okay, then going back to this issue of the different states and different situations and control over movement between states.
So states in India, especially those that are receiving states, like Karnataka is, we have a huge number of migrants coming in, have a lot of autonomy about what they do. And the current, what's called the Unlock 1.0, which is really Lockdown 5.0 in India, is a period where a lot more latitude rests with states to decide what to do. They've had that latitude and they've chosen to use it quite differently. So a state like Kerala, which is a mostly migrant outward state, both within India and outside the country, will have a different set of choices facing them relative to a state like Karnataka. Of course, that will depend on which industries that state has, what the structural institutional profile of that state. So to give you an example, states that have very high construction activity tend to be states that also see, because construction tends to be quite seasonal, will also see a lot of people moving in any case this time of year for agriculture, where they will be moving between states.
Right. And that will be, presumably, is it quite difficult to control movement between states anyway?
Absolutely. In a democracy, it's going to be incredibly hard both to advise people to stay or advise people to go. People are free to move, as they should be. And if they decide that this is a time of great uncertainty and their home state, the state in which the host state, if you like, the state in which they have considered home for work purposes, is not particularly friendly or not helping them in a time of need, frankly, it's very understandable that they would choose to move and go back home. It depends a lot on the industry, and I think this is another area that economists should look at a little bit more systematically, because we see very mixed data from across states. Many migrant workers are in relatively good professions, quite assured professions, places where they can live and work. Many of them who are dependent 6 to a room will not be able to stay.
So people will decide whether to move depending on A, well, whether there's work, and B, whether there's support provided. And I suppose in the UK, obviously, well, there are quite extensive support for people who are unable to work due to COVID-19. Furloughed employers are paid 80%. What sort of support systems are there in India if you are unable to work? And how does that vary between states?
So that's really a question of what kind of worker are you. If you are what would be a kind of casual day laborer, chances are you are in a very, very bad situation because you have no employer system to fall back on. For those who work in what would traditionally be called the formal economy, it would look somewhat similar to what it would look like in many other parts of the world. You would have some kind of system whereby even if you were fired, or if you would have something, you would have a social protection context that you
provided by the state, or provided by a state, or by the federal level?
If you work for a large company, obviously in India, you would be just fine unless you were fired, in which case, depending on the company and depending on the sector, you would have certain kinds of benefits. That is not true by and large for the bulk of Indians. Most
Right.
Indians live and work in quite insecure conditions, and which is one of the reasons why I think it has been quite difficult to compare across countries, because what countries do in a situation like this depends on what both people, the citizens or the residents of that country, as well as the governments, depend on.
Movements of presumably these people with insecure employment back to their home states. And is that, presumably they're still, I believe, I'm told some of them are still traveling at this point?
Absolutely. Absolutely. Yeah.
So how is that playing out?
I think some of the more dramatic stories get told. I think, unfortunately, that's true all across the world. You know, a young girl cycling, which is really heartrending. Really stories of great bravery and courage to get back home, which is very understandable. I think the vast number of workers across the country will have to make difficult choices if they're host states. It's not a great word because it sounds like they're completely temporary, which they're not. Many of them have been in places for a long time or go back and forth. For many of them, they will have difficult choices depending on whether the host state is opening up. If they are really opening up and the sector, let's say they work in the hotel industry or they work in a restaurant, many states that is opening up now. So was it wise for them to go? I think that can only be evaluated in terms of what decisions they had to take at the time.
Because I suppose there's huge uncertainty. But
that's right. That's right. And many.
Presumably there are quite substantial risks of hunger and starvation if people have had to move and then go back to places where there's actually no work. You know, presumably they left them in the first place because it was difficult to earn a living.
I think for states across India, they've had to make some very difficult decisions. Some of them have been very slow to signal to migrant populations the timeline that it might take or the kind of the time it might take for them to open up the economy again. Some of that is because both politicians and bureaucrats weren't quite sure how long it would take. In some cases, they've been a little bit more systematic, saying, please stay, because even if it takes a while, we'll feed you and house you. In some cases, you would have a situation where people have left and then tried to return. That's still happening. So it's not easy. At TC Lab, for example, we have a new program where we're looking at the relationship between food and health systems, precisely to try and look at this. You can't deal with a health surge in your hospital systems unless you deal with lockdown. You can't deal with lockdown until you deal with food logistics. And in a way, you can't deal with food logistics unless you have a backdrop of dealing very systematically with health again. So these things really co-evolve. And for people who are thinking theoretically as well as from a method standpoint, it's particularly important to consider what the data looks like on the ground and what organizations are reporting.
So we haven't got much time left, and I just wanted you lastly to just talk about the sort of future outlook for the Indian economy. I mean, in terms of sort of major elements, because presumably there's going to, I mean, all the economists suggest there's going to be deep recessions around the world. We see the US economy in a particular bad state with still increasing levels of infection, of course now substantial civil unrest, which is also presumably going to lead to increasing spread of infection. How is India going to cope, do you think, with that emerging world?
I think for a country like India, while the central government, of course, plays a critical role, everything from the central ministries playing an active role and so on, there's going to be a huge pressure on state governments to also get their act together. And that's as it should be. It's a vibrant democracy. As you know, it's a very noisy democracy. It's the kind of place where states really do have to step up and figure out what it is they want to do. It's an interesting time in terms of political economy. A lot of state government chief ministers, I think, have national aspirations. And if they do, then this is the time to show what they could do. I think certain sectors, which everyone across the world knows have been hard hit, tourism, the food business, all of that, I think are not going to open up anytime soon. So while they may be slow demand, building out, I think the real problems will be figuring out what to do with manufacturing. As we're speaking, there have been Chinese incursions into Indian territory. We have a standoff of some kind at the border. There are also issues with India taking over as the presidency of the executive board of the WHO. So these are exciting times for the country, both in terms of
exciting and scary. But just come back, one of the big debates here is, of course, between a sort of austerity approach, which we've seen in the past, to depressions or recessions, and an approach that actually looks for stimulating something like a green recovery. Presumably, is that debate live in India, and would it have to be the federal level who would be able to provide the stimulus if there was to be one, and is there any sign that might happen?
So India has gone through many stimulus announcements over the last month and a half. Some of them have been of quite large scale. There's been quite a lot of debate about how large it is in practice. It is, I think, from the central government and from the central banks, I don't see too much more signaling that could be done that the corporate sector hasn't already heard. I think they've heard it loud and clear. I think much of that has been tied up. One of the things that will be very interesting is to understand how the Make in India, kind of the self-reliance program of the Make in India feature going forward, which could be seen as a kind of new ramped up import substitution policy or self-reliance strategy, will play out across the states. This will be partly because many manufacturing as well as service sectors will depend on this. It's very closely tied to science, tech, innovation for India. I think that's quite promising. Some will argue it's too big, too broad, not enough specifics. I think you're seeing some state governments linking it very strategically with migrant returns, as well as in industry and investment to try and do something a little bit different. So to map profiles of skilled workers with the sort of the new version of the Make in India. On the green issue, speaking to climate colleagues of mine and those who work in biodiversity, on the biodiversity end, a lot more could be done. On the renewable energy end, I think India is quite maxed out. It is leading the world in many respects on solar and wind investment. I don't think it can do a whole lot more. There's still a certain amount of divestment in coal that needs to happen, but it's by and large already very green on that end. But in biodiversity and in pollution, I think it can do a lot better.
Brilliant. Well, thank you very much, Smita, for that. Obviously, we're trying to deal with a hugely complex topic in a relatively short time. So it's quite challenging, but I hope we'll be able to return and particularly cover more about the data on health and the implications at another occasion for the next issue.
It sounds good. It's been a pleasure. Thank you.